age-related macular degeneration is the most common cause of blindness in the Western world, and similarly, coronary artery disease is one of the most common causes of death in the United States and the Western world. Interestingly, epidemiological studies have shown common risk factors between coronary artery disease and age-related macular degeneration, and that's why we're interested to see if there is a potential association between both of them, and this can serve as basis for possible either co-screening when we diagnose one of the two diseases, which are quite common, and possibly also adjusting the risk factors and correcting the risk factors for coronary artery disease, which we are actively pursuing now in our current practice, if this will help us decrease the incidence and the prevalence of age-related macular degeneration in the future. So that was the basis for looking at this particular association here. What was interesting is that we had a very interesting population that we looked at, which is the Veterans Affairs patients. And what we found is that there is a strong association between age-related macular degeneration and coronary artery disease, particularly in the elderly, so patients who are older than 75 years in our population. And again, there is a strong association between age-related macular degeneration and common risk factors such as hypertension and being on statin therapy. And older age. This is actually a very interesting area, and it's not a popular area among cardiologists to understand about other diseases and other organs, especially the eye and ophthalmological problems. So now we are gaining more information regarding potential association and regarding coronary artery disease and vascular disease in general, extending beyond the vascular tree and the heart to potential other organs like the eye.
Pay attention when you're looking at the patient, ask questions.
Pay attention when you are looking at the patient. When you have someone with coronary artery disease and the risk factors, it might be of value to refer them for ophthalmological examination, looking at age-related macular degeneration, especially in the elder population.